Welcome back, everybody, to Factor Care Podcast. It's myself and Stephen Lee once again. And so now that we've kind of broken through some of the ice, we're just going to be ourselves for a little bit instead of being all stiff and uncomfortable because we haven't done this before and never thought we would.
How about we start off on, let's talk about hemophilia. So what is hemophilia?
Yeah. So, I mean, you're the scientist. So, like,
okay. So I guess since I'm a pharmacist, I'll start off on that. But basically, hemophilia is going to be a genetic mutation. It's a disease state that causes your body to be missing or may produce less of a specific clotting factor. They typically or be a hemophilia A or B, and A is missing clotting factor 8 or has a lesser amount of it,
right.
And a B is clotting factor 9. And what happens is, without all these clotting factors, your body can't necessarily heal. It can't clot. You can have broken vessels that will continually just bleed out.
Yeah.
And that's what really causes a lot of our issues. One of the things that we always hear is like, oh, well, you're a free bleeder. And they think of like we cut ourselves shaving.
I heard that a lot as a kid.
Yeah.
Like it was a lot of like, that was the example that was used all the time that I cringed. I'd be like, that is not what happens. This is not how this works.
I've definitely cut myself shaving a few times. I'm still here. So a lot of people won't really understand that it's actually a lot to do with bleeding in the internal spaces of your body, especially your joints are the problem areas.
Yeah.
So, and trust me, we've had no shortage of joint bleeds. I mean,
target joints is usually the definition that we get on.
Yeah. So once we get a couple bleeds, once in a while, they'll consider a target joint. And I know mine or my ankles and my elbows. I've had surgery to repair my elbows. I know yours are your knees.
Yeah.
And it's just one of those things where people don't realize is that while the blood is pooling in this joint cavity or this joint space, these inflammatory mediators and other things are in the blood. It's causing damage to the joint. It's causing damage to the bone. It's causing arthritis, the thinning of your synovial space and that cartilage, and it really can cause crippling disabilities.
Which you have scars on both your elbows because of the synovectomies, right?
Yeah. So I had frequent bleeds in my elbows. Those are my target joints. I was an ambitious teenager working out at the gym every day, trying to always improve upon what I did the previous day. And I learned a very hard lesson is that we need to take it easy on ourselves, because though we may want to skip and go from A to C, we really need to go A, B, C, because through that forcing myself to progress, I damaged my elbows where they were no longer usable I had to get radial head resections and synovectomies of both my elbows, and I learned the lessons like, hey, you're on this world with one body, and you got to take care of it, because it just makes your life more difficult, and it made us understand about the importance of what we have available today: better medicines, longer half-lives, prophylaxis. That our generation was really the generation that piloted prophylaxis.
Yeah,
but it's they did a quick fix on my elbow, what's available at that time, as many 10 plus years ago. But here we are today. I'm functioning. I still live with a little bit of pain, but it's things that I learned that, hey, I have to take that on and let's preserve the other joints I have, my knees, my ankles, things of that nature. So in general now, I try to do lighter exercises and just maintain bone and muscle strength.
Yeah, I think the benefit that I had was when the HTCs that were all over the country and different, when they're trying to figure this out in the early 80s, it was almost like, let's shelter and kind of keep our kids padded up. I know a lot of kids had helmets, things like that. And mostly it was a lot of it was based out of fear because of the lack of knowledge as we were getting better medications to be able to better treat the area that we're dealing with. My parents were basically like, look, you're only here because God had you here. We believe, like, just by faith that you're gonna be here, and we're gonna let you be a kid until, within reason. I mean, they were still listening to the hematologists and the nurses and Karen, who was amazing at Tulane, and the staff there who were just great. But I'm sure that my parents drove them a little nuts. It's like, okay, we're gonna let him be a kid, and so we're gonna let him play with that in reason. So baseball was pretty much my sport of choice. I played basketball for a little bit, but stuck to baseball throughout, then track. So for me, blowing out my knee was pretty much a wrap my freshman year in college, going into my first baseball season as a collegiate athlete. So that was basically the end of that.
And while each of us were so different, our family dynamics are also different in our community. And like opposite of you, my parents kind of treated me as a bubble boy.
Yeah.
I didn't get to play sports, and I had to stay indoors all the time. So, I did video games and whatnot. That was very fun. But I didn't get to play basketball when the other kids were playing basketball or other sports. But, from your experiences playing sports and having injuries, like you kind of learned what you can and can't do. And for me, just the little bits of basketball, realizing I'm rolling my ankles.
Yeah.
And here I am 38 years later, 40 years later, and my ankles are an issue. It made you realize, like, hey, you know what? We've learned these things and what we could have done differently. Mm-hmm. So, for instance, what would have been brighter is maybe I should have wore high top sneakers instead of low tops. That way they would have better protection around the ankles, and I'll be less likely to roll my ankles or maybe I shouldn't have played certain sports at all. But luckily we've learned those things over the years, and we've made modifications in our life to change that. And basically what we're hoping to do in this journey is to help other people make those decisions without having to hurt themselves.
Yeah, making the same mistakes that we made, basically. So I know for me, it was like full throttle all the time. I did not stop. My parents, I was constant motion. So I was a little quiet too, but a little mischievous in that. So I think I was in trouble a good bit as well. But I know I was banging off everything and running into tables in my head when I was little, and just, anything that could happen that you don't want to see happen with your child with a chronic bleeding disorder, I'm sure I did it. So like an example of really horrible bleed, like a sort of fracture in my right leg. Okay, at one point in time, so my dad, he worked at a church. He's a missions director for our church pretty much my entire life, in different ministries. But at this one, they had a situation where he was going into his office, going to work one day. I am casted up from like literally right below my hip area all the way down to my bottom of my foot. So they were trying to really like limit the mobility that I had, because even though the fracture wasn't bad enough to do that, I was so active that they were trying to slow down and trying to deal with the bleeding that I was having, because it was so traumatic apparently that it just couldn't quit the bleed stop it from happening. So the story basically goes, and it's better if he tells it at some point in time down the road, but that he walked into his office, the secretary from the front comes to get him, and her verbiage to him about what happened is, look, Josh is running across the gymnasium, and I know you said he had a cast on, but it wasn't on. So like I think I'm 4 or 5, right around there, probably about 5. So they recasted me 3 times. And what I had been doing was, he called me the 3rd time. What I did was the building was built out of cinder blocks. I had gone to the outside and found one of the corners, and I was beating my leg against it, kicking it until I knocked the cast off, and then just on the road again. So this is how we make bad decisions starting at a young age and then keep going. So you had the benefit of doing what probably was best in those situations, but at the same time, I think there was another benefit to me being able to be so active. That's helped me too now at 43. I know you're just almost 40, so yours is more almost upper body. You do have your ankles, but like for me, it's my knee. I went 11 years after I blew my knee out without doing surgery, against the doctor's advice, because I just did not want to get cut on.
Yeah, but now it'd be a good time to talk about treatments, right? So, we both had these bleeds, and, how long we took to treat them made a great effect on how much damage we had to our joints.
Yeah.
So you had a knee blowout, but were we getting enough factor? Were we scared of going to the doctor? There were so many things that, both of us being first hemophiliacs in our family and whatnot, that we had to work our way through, because, we relied on our parents, and maybe the parents, if you're the first child, it's
trying to
figure it out. So I know, we have products available now, factor replacement, which is the treatment for hemophiliacs, is factor replacement. And we have products now that last a long time. I know you're on one that I used to use, and now I'm on a longer acting version of it. But, we had to overcome these boundaries and these obstacles and in our head where, as a 4-year-old, you didn't want to get stuck. I definitely didn't want to.
I was fighting it.
Yeah. So, I'm in a fortunate situation. My parents owned a deli a block from the HTC. So I would just skip school that day, go to my mom's deli, and then when it was appointment time, walk over to the HTC, and they would infuse for me. But not everyone has that that luxury.
No, I dreaded going down there because I associated that with pain. So I would almost try to hide the bleeding. I remember doing this at even 11, 12 years old, like trying to just make it seem like I didn't have a limp for like 3 days bleeding until they finally were like, okay.
Yeah, that's definitely the case when I was young. I'd dread telling my parents so much that part of me was hurting because I knew a shot would come shortly after that. And I guess I was between scared of needles and scared of my parents thinking that, hey, I was being bad or something. That's what's caused it. But
Yeah.
for the most part, they were always understanding. It's just my own fear that I had to overcome. But, you know, it's one of those things where, you know, in hindsight, I realized getting factor sooner is always better.
Yeah.
You know, the type of factor that you're on can also dictate how much flexibility you have. So, like, for instance, me, I can basically give myself factor and go 1.5 weeks without getting redosed.
Yeah.
If I'm on a vacation, I might just factor up right before I leave on vacation.
Yeah.
You know, instead of having to bring a dose on the airline with me or 2 doses.
Yeah.
So that,
which can be a pain in times for sure.
Yeah, but learning how to navigate, you know, traveling with factor, keeping it cold, what temperature does the factor actually have to stay at? You know, a lot of those things, it comes to us refrigerated, but many of the products available today, you know, they're room temperature stable for a month or longer. So you don't necessarily have to keep it cold. You just got to keep it room temperature or cooler.
Right.
Yeah. So.
No, I mean, yeah, and there's so much to this. My mind starts to just blow up with all the different avenues we can go down with this. But I know even until recently, so I'm in my 30s, still not want to do the prophylactic treatments, like fighting it. Like I'm basically doing on demand, even though it's supposed to be done prophylactically. So like that schedule, I just never wanted to give into it. That wasn't just like a college phase for me, like where I was kind of working my way through it. It was more of like, this is a life thing where I'm just that stubborn that I'm going to keep fighting through it. Now, 43 now, like having the issues that I've had, having a knee replacement that really they said needed to have 7 years ago, I'm still kind of in that area, but I'm always trying to be in good health and take care of myself. I definitely need to work on my nutrition, which is something we'll talk about later. But yeah, that scheduled, and I think it all started when we're younger, right? So it was like you get injected. There's a combination of fear. It's not just you, like you can sense as a kid what your parents, like what's going on. So as good as my parents were and as loving as they were and as fortunate as I was, at the same time, like I still remember sensing that kind of like apprehension to, even though they knew they had to do it, which mostly was holding me down, you know, it was something that was painful for them too, just out of the box. But on top of it, not knowing if that was going to be an injection that actually potentially could take my life long term. So it's like, we got to do this to like, and so I have a lot of respect for our parents. Like the fact that they lived through that period in time is remarkable that they're saying it all. Like having my own children now, thinking about what they went through is just.
I mean, it's definitely scary. I can't imagine what my parents went through when they had me because I was totally unexpected as far as the disease state goes. Yeah. But you know, as far as scheduling the medicines though, I mean, I was the kid that was at the HTC 3 times a month getting infused because whether it was spontaneous or injury, it would just about happen 3 times a month. And it wasn't until actually after I had surgery, they're like, hey, you know, yes, sir, it would be beneficial for you to continue giving this factor to help you heal and everything else and decrease any risk of bleeds. Since I just had this major surgery, so I started prophylaxis. And since then, I have 0 spontaneous bleeds, and that's been multiple decades now. Well, at least a decade. And really, any bleed I do have is typically trauma.
Yeah.
So I mean, I
kind of know it's coming.
I can't preach prophylaxis enough. I can't preach joint preservation enough. You have things like sports and whatnot. I understand we want our children to have their freedom to do and pursue the things that bring them joy in life.
You want them to live their life. You don't want it to be a situation where they like feel like a prisoner.
Yeah, but we also need to let them understand like, hey, there's consequences or actions, and you know, maybe contact football is not the best idea, but hey, if you want to get into a sport, maybe you can do maybe a lower impact one like baseball or something else.
I think basketball actually turned both our ankles.
Yeah.
So it sounds like you went through the same thing I went through, which is why
Yeah,
ended up.
I rolled my ankles many times playing basketball. So yeah, I don't do that anymore. Just
Yeah.
just because of the ankle issues now. I mean, I really can't even run on concrete. I'm bone on bone in my ankles.
Yeah.
Yeah. So
Same thing for my knee. So like I'm there. So like it's been such a weird road. And as we're kind of starting like the podcast and getting everything set up and just starting to open up to everyone and let them know what we're going through and what we've been through and then what's going on. And as we start to bring people in here that have different experiences, I know ours have been extremely blessed. Like we both been married for extended periods of time. We both have children. It's been amazing to be blessed the way we have, but almost more importantly, to have like a background of people that support you, love you, and then are there for you regardless of the circumstances. Because both of us, like for mine, was chalked up to a genetic mutation after a 7-year study. Just trying to do genealogies, trying to figure out what happened.
mm-hmm.
They at the end of the day, they chalked it up to genetic mutation because we just couldn't find the correct answer.
Yeah. It's just so hereditary
Right.
too. So it's passed along the X-linked chromosome. So it'll pass to a female, and a woman will pass it to their son.
Right.
So
I worry about that with my daughter. Obviously, there's a lot of fear associated with that. I don't even want to go there. She's 7, so.
Yeah, but it's one of those things, like you said, like we have been fortunate enough to have a very supportive family that loves on us and takes care of us and care enough about us that they make sure that we have whatever we need to get by, and really that's kind of our calling. I mean, that's what we want to do for others. We want to let them know that, hey, we understand what you're going through, and we're here to help.
Yeah.
There's no one better to help you than someone that's walked through your shoes, and basically, in reality, is I don't want you to walk through mine. I want you to take a better path.
Yeah.
I want to tell you the mistakes that I've made, and that way you're not limping like the two of us, where we walking around slow and limping. I want you to stay healthy and as long as possible, and that's really our calling, right?
Yeah. No, that's it. Like learn from our mistakes. Hopefully we can get out some good information and data to people that it'll benefit in their quality of life in a better way somehow. We don't even know what that looks like. Like as we're kind of like fumbling and working our way through, like just even getting comfortable here, I'm excited because like I think what's going to come out of this really is it's not only going to benefit other people, but ourselves and our family. Like it's exciting to see the direction that we're going in as we're laying the foundation of the company here and like getting everything set, because the reality is like our heart is to do nothing more than serve. There's a lot of different ways to make a living. Neither one of us had to be here, like uprooting my family out of like the St. Tammany Parish area to this, in Lafayette, which I absolutely love and don't want to go anywhere else. But as we're getting the foundation of this thing laid and starting it in our home state where we're from, where it really means the most to us out of the gate, I'm excited about what's gonna come out of this. Just loving on people, trying to be available, like regardless of the circumstances. So, this is gonna be good.
Yeah, I mean that's what we're here for. That's why the pharmacy is here. We're here to not just dispense a medication. We're here for the patient. We're here to help them. We're here to answer their questions, put them at ease. We're here for many of their needs. Just give us a call if you ever have a problem. And if I can't help them, we'll find someone that will.
Yeah, that's exactly.
And that's really our calling, and that's what we want to do. And the pharmacy is just a method for us to do so.
Right.
That's a method for people to be able to access us. And we can also fulfill their medication needs, but on a level that is probably they weren't getting prior, with people that understand what they're going through, with people that understand the disease state a little bit better, and people that live through the disease state.
Yeah, and it's like putting ourselves out there to serve, but I can't say enough, like people won't really understand us and believe us until they've had that experience with us. They don't need to be our patient for us to be able to help them. That's not why we're here. That's not why we've done all this. Like we are literally here locking arms saying, okay, like we're going to do everything that legally we can do and are allowed to do to take care of that patient. If we can't, we're finding like a nonprofit that can help you on the other side of the fence, or another pharmacy that if it's not working for you. Like I think it's going to be a long time, potentially, hopefully not, but I think it'll be a long time before people understand, because I think a lot of people have started off the way we have, but at some point in time, like they kind of get steered into a different direction because of like bottom line, what do those numbers look like? And so for us, being a hole in the wall, small little in the middle of like Mayberry, like pharmacy, I think we can make a big impact here, and I think we're already starting to do so, but I'm looking forward to serving the community more and expanding outside of that, because it's not just bleeding disorders. Like there's a lot of people that are hurting in the same situation, whether it's cancer, like there's a lot of other areas that legally will be able to help people. So I'm excited about that too, that diversification, but starting here, where we are and understanding everything it's really what this is about.
Yeah. And having that bottom line not be so definitive, it's not the end point. It really helps us not worry about, like, hey, if you're going to lose, like a lot of people don't realize this, but sometimes a pharmacy may not want to fill a patient's medicine because they're losing money. I don't want a patient to feel like a second-class citizen just because the pharmacy can't make money off of them. No, we're here to help.
Yeah.
Whether we make money off of you or not, whether you fill your medicines with us or not. If you have a question, always feel free to call. You can look us up on the website. You can look us up on Facebook.
Yeah, which isn't still processed, but like as we get those things laid out, again, can't stress enough, like you're going to get, even if you're just whatever, like you'll get our cell phone numbers, 24/7 access, especially to someone like Steven, who is like, you're so good in understanding and having a good knowledge base of coming out of the retail world is great because you have all that other knowledge that you're able to carry over. So like there's a better ability to be able to help someone, and understanding as a patient, the specialty side, like you're extremely valuable, and having someone that I could trust to lock arms with to get this thing started, it's exciting. So
yeah, absolutely. And not only that, just both of us filling medications through other pharmacies, and we know the things that we nitpick about, the multiple phone calls that you have to call back and you're playing phone tag for a week just to order medicines. We want to be able to streamline that process to make sure that when you call, you reach someone and we can get that order process as quickly as possible with a quick turnaround. And it's really due to, being a low volume, being able to talk to and know your provider, speak directly to them, type of pharmacy versus a big machine that does 1,000 prescriptions plus a day.
Not another number, or like
they're not another prescription, they're not a number, they're a person.
We're not seeing dollar signs, so I think it's going to be by example and just showing people. That'll be really the telltale. It's not going to be us so much talking about, but I am excited about what's going to come out of this. So
yeah,
let's get going.
Let's get them.